And we definitely want to help you keep an eye out for your health and the health of your loved ones. We sat down with Dr. Kohli to talk about signs to look out for when it comes to a stroke. Take a look.
Dr. Kohli, we've been wondering about strokes lately. This is something we've been thinking about a lot. Now, I want to ask you, are strokes something that many of us should be worried about, first of all?
You know, we think it's not going to affect us, Danny, or affect any of our family members. But, you know, every 40 seconds, so while we've been talking, somebody has a stroke.
Wow.
And so the burden and the morbidity and mortality of a stroke, as you can imagine, is tremendous. And if you ask people, what is the one health condition that they fear having more than anything else? Most of us would say stroke. So it's really important to raise awareness of this because there are things that we can do to prevent this and are things that make us higher risk.
Yeah, definitely. And I think a lot of us have kind of heard inklings of ideas of what you can see in terms of, you know, when a stroke is about to happen. So what are some of those signs of a stroke that we should look out for both in ourselves and in others?
Very important to know this because time is brain.
Okay.
So the faster that you move, the more likely somebody's to recover from their stroke without long-term sequela.
Wow.
And when in doubt, you sound that alarm bell because it could be a fake out, it could be a migraine, it could be something else, but it's important to get it checked out. So I would say FAST is the acronym.
Okay.
F stands for facial drooping. So if you see any kind of facial asymmetry, whether it's eyebrows, eyelids, tongue, or even the cheek drooping on one side more than the other, then you know, that could be a stroke happening. Okay. Also, any kind of language or speech problems as well. A is for arm weakness. So if you have your arm drifting or your leg drifting, or you suddenly feel one side of your body getting weak or numb, that could be a stroke as well.
Wow.
S is that speech difficulties I talked about. So if you're either having trouble getting your words or you're mixing up your words, sometimes we call that word salad. You're saying a bunch of words, but they don't make sense in a sentence together.
Okay.
Or you're stuttering a lot. All of that could be. And then T is time. Time to call 911 right away. So FAST, facial asymmetry, arm weakness or tingling, speech difficulties, and time.
Okay, and obviously if we're experiencing this within ourselves, that's something we should probably tell someone else, right? Okay, time to call or help us out. Something's going on here, right?
It's true, although sometimes if we're having those kind of speech difficulties, we may not even have insight.
Right.
Because we're inside our body and our brain tells us when something's wrong. So if something's actually happening in the brain, like a stroke, we may not be able to tell somebody else. So that's why it's really important for us to keep that radar up for other people. Now, where in the brain the stroke happens can determine the symptoms. So sometimes it can be even very subtle, such as you're just sort of feeling maybe like your legs are about to give way or something like that. So again, if you have risk factors for stroke, just have a low threshold to get it checked out.
Okay. How about prevention? Are there ways that we can make sure that this doesn't happen to us?
We can. And you know, the blood vessels that supply blood to our brain are some of the most delicate, fragile blood vessels out there. So you want to protect them and keep them healthy. And the way to do that is the same things that keeps your heart healthy. High blood pressure, high cholesterol, diabetes. And for women, especially Danny, men also, but women even more so, smoking is a huge one.
Okay.
So smoking can substantially increase your risk of having a stroke, especially if it's combined with any kind of birth control pills. And we've seen even secondhand smoke can increase your risk of stroke. So just sort of staying on top of your preventive health, getting those screenings regularly every year. And if you have a family history of stroke, then you probably want to start even earlier.
Okay, I love this in terms of prevention, making sure that we know what we have to do and just keep an eye out on your loved ones. Dr. Kohli, thank you so much.
Well, if you have a topic or you have a question for Dr. Kohli, you can message us on our Facebook page, Colorado and Company on 9 News. Your topic may just end up on the show.